cases from cumulative days. If we look at the current hospitalized number, we're down 21 to 108. So if you'll remember, our hospitalization numbers and our mortality figures are hard numbers. So those are much easier to track than the COVID-19 case reports. We do have, over the last week, one complaint from a retail establishment. So thank you for those reports. So if you are around the Mobile County Health Department today, you'll see many of us are wearing purple. So I would like to ask Veronica Mercandale to come in. Veronica is our Overdose program manager, and she's going to go over the significance of why we are wearing purple.
Good afternoon. In case you were curious as to why we're all wearing purple, it's because it's in observance of International Overdose Awareness Day, better known as IOAD. Communities in Mobile County and around the world are coming together on Monday to remember those who have died or suffered permanent injury because of drug overdose. Observed on the 31st of August each year, International Overdose Awareness Day seeks to create better understanding of overdose, reduce the stigmas of drug-related deaths, and create change that reduces the harms associated with drug use.
Okay, thank you very much, Veronica. So it's been a busy week, both at the state level with Governor Ivey's amended Safer at Home order, and then we also had some changes at CDC that have caused, I think, some concern, and I'll review that for you. So Governor Ivey did extend the Safer at Home order until October 2nd. And there were a couple of changes that will go into effect on August 31st at 5 p.m. Both of these changes really affect our dining institutions. So the first change is in Section 19, letter C, and this describes changes in how hospital service areas and cafeterias will operate. So both hospital food service areas and cafeterias that are operated by educational institutions are basically allowed to develop their own social distancing plan, and they are now excluded from this section of the amended order. I think more locally, and what will impact most citizens, is that establishments that are operating buffets, salad bars, and self-serve drink stations are allowed to do so, but they do need to ensure that at least one employee is stationed there, and they're responsible for maintaining the 6-foot social distancing among the customers, using the buffets, salad bars, or self-service drink stations. They are also required to provide hand sanitizer and encourage customers to apply it before using these machines, salad bars, or buffets. The other area that you may have heard about came from CDC, and it basically addressed the 14-day quarantine period. And there was some confusion because several different reports were basically submitted at the same time from CDC. So let me be clear. What changed in the CDC recommendations is those that are traveling prior to the change were required, and when I say travel, I mean outside of the U.S., were required to quarantine for 14 days after the return. That is no longer the case. So you do not necessarily have to quarantine for 14 days. However, if you are exposed to anyone who is a confirmed case, you do have to quarantine for the 14-day period. And I need to be very clear about this. Testing does not get you out of that quarantine time. You are still required to quarantine for that 14-day period. Okay, so let me move on. All right, let me move on to our questions that we received this week, and I'll start with the media questions. So I had a question that came in, and unfortunately, to the news media that submitted this, they were asking about the changes in testing from CDC. So I hope that we have clarified that nothing has changed for most of us. So if you are a confirmed case, you do have to isolate at home for 10 days. And that last 24 hours must be symptom-free with respect to fever, and you could not have taken any fever-reducing medications. Also, if you have other symptoms, those symptoms should be getting better. If you are exposed to a confirmed case, then you do need to quarantine for 14 days. And again, testing does not get you out of that 14-day quarantine period. Okay. So another media question says, I'd like to ask about what the early signs are from college reopenings in our area and how the department is working with them on contact tracing. So I'm sure that you've heard about the situation at Tuscaloosa with the number of positive cases reported there. I can report that the University of South Alabama, looking at their website, they have a very low percentage of positive cases. It's 0.52, which is very good. And again, that is kind of a baseline percentage for the students returning. The aspect in which University of South Alabama is tracking their students is based on the GuideSafe program that was developed at UAB. And so the students can register for GuideSafe. You have a symptom tracker within that phone app that you self-report symptoms, and GuideSafe will walk you through the process and whether you are a potential case or not. It also has an optional component that you can sign into that uses Bluetooth tracking and proximity to other phones to let you know if you are exposed. So I have this on my phone. Anyone in the public can actually download the GuideSafe app, put in your information. I will be very clear that the GuideSafe program does not collect personal information, and it is anonymous. If you do report yourself as a case, then that is also kept private. My second media question is, has the state or county health department ever produced any kind of report identifying clusters? So a cluster is a location typically around an event or a service provider like a bar or a restaurant. That would be a point source for a COVID-19 outbreak. The reporter goes on to say, I've seen reports from other states identifying the places that are responsible for multiple infection. For instance, bars and restaurants are associated with X number of outbreaks, workplaces for X number, etc. Do you have anything like that? So what we're talking about is the opportunity, like I said, for a location or an event to either become a index point for spread, or even what we would consider a super spreader event, where you potentially have hundreds of individuals that are affected. So we actually have not done this specifically for COVID. We have done that for other outbreaks and communicable diseases. But for COVID specifically, beyond what we're producing with respect to the heat maps in our expanded report that produces or shows number of cases by zip code, we do not do this. Now, we have brought on board a GIS analyst, which uses geospatial analytical techniques, and that will facilitate our ability to do this type of mapping in the future. Our current strategy is, as we're going through and talking to known cases, to identify common areas. The other question that I have had this week that goes along with this is, are we seeing any effect from the football games? And it's really too early to tell from the games that happened a week ago as to whether we're getting an increase. So by the time they come through the system, it would typically be middle of next week before we would see that spike. Okay, see where, okay. And then we have some questions from Facebook. So the first one is one of our Facebook readers or viewers wondering why female positives are so much higher than males. So this is a bit of an issue because you're looking at absolute numbers. And so to provide context with that, you have to understand that females are better healthcare seekers than males are. And that's across most spectrums, and it's certainly with COVID-19. So females typically will go and have tests done. So if you're looking at the absolute numbers, then ratio of cases to among females to cases among males is going to be elevated, but remember that is not a rate. How does this compare? I'm assuming that means how does the COVID-19 cases compare to last year's flu season? So I will say this. We are outpacing flu by 4 to 5 times the magnitude. COVID-19 is no joke, and I know that there was a lot of comparison early in the pandemic with flu. For seasonal flu, which we have seen over the last 10 years or so, COVID is outpacing it. To give you another benchmark here, our COVID deaths in 2020 have outpaced any of the HIV/AIDS deaths that we saw at the height of the HIV AIDS crisis. So I hope that gives you some context. Our next question is, what is a safe rate of positivity? So this probably goes back to a question or a response that I gave about background rates and when we don't need to wear masks. So what we're really interested here is to have enough individuals that are not susceptible to COVID in the environment, in the population, such that viral transmission is not very efficient. And those of you that follow this a little more closely may think about this as the R ratio, the R statistic, which is the number of individuals on average that are susceptible that an infected individual can infect. And we want to see that R value under 1. And that means that if it's under 1, a single individual on average is not infecting another person. And that's where we start to see the epidemics go away. So that's really the benchmark there. Then another question, I'll have to interpret this a little bit, is that this viewer notices that she, so I'm assuming that's Randy, says died with COVID, not from COVID. So if you die from something else, even a car wreck, but had COVID in your body, you are counted in the died category. So no, that's not actually the case. So the deaths that are tracked through vital statistics. So that's your death certificate. And the physician or the coroner or the medical examiner fills that out, that document. That document is a very extensive document. And it does have a primary cause of death, and then it may or may not have secondary causes of death. And in some cases, you'll have a primary cause of death with COVID being a contributing factor. That is because COVID can affect other organ systems, including vessels in the brain, and that can cause disorientation, etc. So there is a wider net that's cast right now until we are able to really understand what the COVID-19 contributions are to mortality within Mobile County. I can say this, though, that if you look at the CDC data, which evaluates the mortality starting on February 1st through now, and compare 10 health indicators to historic levels, all 10 are elevated, including overdose. So COVID is having an effect beyond just the straight died from COVID event. So if you're feeling, for instance, like you need some help and need some counseling with your drug of choice, please seek that out, because I know people are struggling with this. Okay. I had a question that was asking about a paper that was published from CDC, and this is available through their website. And this paper looked at specifically, well, they actually looked at several comorbid conditions. And remember, comorbid conditions are simply other diseases that you have in addition to COVID. And this paper basically looked at someone that was infected and looked at members in their household and determined what the transmission rate, or what's called the SIR, which is the secondary infection rate, attributable to that primary infection. And it was elevated, and having diabetes puts you in an increased risk category based on an odds ratio calculations. The question that we received is it likely that diabetes puts you at risk of transmitting COVID-19? So the paper in question from CDC didn't actually address that. It wasn't designed for that with respect to initial identification of the population, or it didn't have enough diabetes patients or comorbidities in there. I did look at a paper which is a review article that, and you can access this from the Lancet. Its publication date is September 1st. And it did a review of all known published studies about transmission. That paper did not indicate that there was an increased risk of a diabetic transmitting COVID, but it re-emphasized the issue that diabetics and those with these other underlying medical issues do have a more or a worse outcome rate than those without the underlying conditions. And a lot of this goes back to the immune system. I can tell you that diabetics are more likely to be infected. And if we look at SARS from 2003 and MERS, that panned out where diabetics were more likely to be infected. Okay, and then, all right. So I also had another question, and I know that the 10-day isolation and 14 quarantine days is confusing, and a lot of people are trying to put those together. You should not do that, because they are based on two different aspects of viral dynamics. So if we talk about 10 days of isolation, what that is based on is a person without any immunocompromised conditions being able to transmit or shed virus that potentially can infect someone else. So that's that. It's transmission dynamics of SARS-CoV-2. When we talk about the 14 days of isolation, that's based on the incubation period of SARS-CoV-2. So please don't try to put those together. You can actually end up dovetailing those at the end, where if you have somebody that's on their 10th day and you're exposed to them, then you end up with a 14-day quarantine period, for instance. So close home contacts can potentially end up being quarantined or isolated for over 14 days. So I hope that clears it up. Don't try to put those two metrics together. One is based on viral shedding, that's the 10 days. 14 days is on the incubation period. Okay, I think that pretty much wraps up the questions that we had submitted to us. James, were there any that came through Facebook? Okay. Maybe people have other things to do today. I do want to remind everybody, Labor Day is coming up. Please, as you're getting your groceries and your ribs and thinking about being with family, please include a discussion and some thoughts around conforming to the recommendations. Wear your mask, socially distance from people that are not part of your immediate household. We do not want to see another spike like we saw July 4th. Also, please, when flu shots become available, and I've seen the signs up, please get your flu shots. It's critical to be able to differentiate flu from COVID-19. I also want to say our thoughts and prayers are with those that are being affected by Hurricane Laura. There will be relief efforts. Mobile County Health Department is contributing to those. But if you get an opportunity, most of us have been through major hurricanes here in Mobile. But if you have an opportunity to contribute, please do that. So I look forward to everyone joining us on Monday. We'll have our expanded report at that time. And thank you very much.
Past, as you